A quick guide to creatine. This text was generated by AI and the presentation is done by AI. Normally we produce content in Swedish, but at this point, English sounds better computer generated. We will take a closer look at these topics. Introduction, definition of creatine, its role in energy metabolism and how it is produced naturally in the body. Benefits of creatine. Creatine has been found to enhance athletic performance, increase muscle mass, and improve recovery after intense exercise. It can also be beneficial for individuals with neurological diseases and vegetarians who may have lower levels of creatine in their diets. Forms of creatine. Different forms of creatine, such as creatine monohydrate, creatine hydrochloride, and creatine ethyl ester, can be found in supplements. The lecture will discuss the benefits and drawbacks of each form and what to look for when choosing a creatine supplement. Dosage and timing. The appropriate dosage and timing of creatine supplementation will be discussed, as well as the potential side effects of taking too much creatine. Combining creatine with other supplements. The lecture will also cover the effects of combining creatine with other supplements, such as caffeine or beta-alanine, and how to properly dose and time these combinations. Precautions and warnings. The lecture will cover precautions and warnings about creatine, such as potential interactions with medications, the importance of staying hydrated when taking creatine, and the potential for false positive drug tests. Creatine is a substance that has gained popularity among gym-goers and athletes due to its potential to improve athletic performance and muscle growth. So, what exactly is creatine? Creatine is a naturally occurring substance that is found in the body and is also present in certain foods, such as meat and fish. It is a nitrogenous organic acid that is synthesized from 3 amino acids, arginine, glycine, and methionine. Creatine plays a crucial role in providing energy to muscle cells during intense physical activity. The human body uses a molecule called adenosine triphosphate (ATP) as its primary source of energy for all metabolic processes, including muscle contraction during exercise. When ATP is broken down during physical activity, it releases energy that is used to fuel muscle contraction. However, ATP stores in the body are limited and can be depleted quickly during intense exercise. This is where creatine comes into play. Creatine is stored in muscle cells as phosphocreatine. When the body requires energy during exercise, phosphocreatine donates a phosphate molecule to ADP, which creates ATP. This process provides a rapid source of energy to fuel muscle contractions during high-intensity exercise. Therefore, creatine plays a vital role in energy metabolism, particularly during short bursts of intense exercise. The body naturally produces creatine in several organs, including the liver, kidneys, and pancreas. The process of creatine synthesis involves the combination of the 3 amino acids arginine, glycine, and methionine. Once produced, creatine is transported to muscle cells where it is stored as phosphocreatine until it is needed to produce energy during physical activity. Creatine has been shown to improve performance in high-intensity short-duration activities such as weightlifting, sprinting, and jumping. This is because creatine helps to regenerate ATP, which provides energy to fuel muscle contractions during exercise. By providing a rapid source of energy, creatine can help athletes perform better and for longer periods of time. In addition, creatine has also been shown to improve endurance performance, such as long-distance running or cycling. Another benefit of creatine is its ability to increase muscle mass. Creatine has been shown to stimulate the growth of muscle fibers and increase muscle protein synthesis. This can lead to an increase in muscle mass and strength over time. Creatine can also improve muscle recovery after intense exercise by reducing muscle damage and inflammation. In addition to its benefits for athletic performance and muscle growth, creatine may also be beneficial for individuals with neurological diseases such as Parkinson's and Huntington's disease. Studies have shown that creatine supplementation can improve cognitive function and delay the progression of these diseases. Creatine may also be beneficial for individuals with traumatic brain injuries or spinal cord injuries. Lastly, creatine can be beneficial for vegetarians who may have lower levels of creatine in their diets. Creatine is mainly found in animal-based products such as meat and fish, so vegetarians may not consume enough creatine through their diets alone. Creatine supplementation can help vegetarians maintain healthy levels of creatine in their bodies. Creatine monohydrate is the most common and widely researched form of creatine. It has been shown to enhance athletic performance, increase muscle mass, and improve recovery after intense exercise. Creatine monohydrate is easily absorbed by the body and has a long history of safe and effective use. However, some individuals may experience gastrointestinal discomfort or bloating when taking creatine monohydrate. Creatine hydrochloride, HCl, is a newer form of creatine that is marketed as being more easily absorbed by the body and causing fewer side effects than creatine monohydrate. However, research on the effectiveness of creatine HCl is limited, and there is little evidence to suggest that it is superior to creatine monohydrate. Additionally, creatine HCl is more expensive than creatine monohydrate. Creatine ethyl ester is another form of creatine that is marketed as being more easily absorbed by the body and causing fewer side effects than creatine monohydrate. However, research on the effectiveness of creatine ethyl ester is also limited, and there is little evidence to suggest that it is superior to creatine monohydrate. Additionally, creatine ethyl ester is more expensive than creatine monohydrate. When choosing a creatine supplement, it is important to look for products that have been tested for purity and quality. Look for products that have been certified by third-party organizations such as NSF International or Informed Sport. When it comes to creatine supplementation, it is important to follow the dosage instructions on the label and to not exceed the recommended dosage. The standard dosage for creatine monohydrate is 3 to 5 grams per day, taken either all at once or in divided doses. Creatine hydrochloride and creatine ethyl ester may require smaller doses due to their higher absorption rates. It is important to note that creatine loading, or taking large amounts of creatine for a short period of time, is not necessary and may increase the risk of side effects. Timing of creatine supplementation can also be important. Creatine is most effective when taken before or after exercise. Some research suggests that taking creatine before exercise can improve athletic performance and increase muscle mass, while taking it after exercise can improve recovery and reduce muscle soreness. However, taking creatine at any time of the day can still provide benefits. Creatine is often combined with other supplements to enhance its effects on athletic performance, muscle growth, and recovery after exercise. Some common supplements that are often combined with creatine include caffeine and beta-alanine. Let's start by discussing the effects of combining creatine with caffeine. Caffeine is a stimulant that can improve energy levels, mental focus, and athletic performance. When combined with creatine, caffeine may enhance the effects of creatine by increasing blood flow and reducing fatigue. However, it is important to note that caffeine may also cause dehydration, so it is important to drink plenty of water when combining creatine with caffeine. Additionally, caffeine can interfere with the absorption of creatine, so it is recommended to take these supplements at different times of the day. Another supplement that is often combined with creatine is beta-alanine. Beta-alanine is an amino acid that is involved in the production of carnosine, a molecule that helps to buffer acid in the muscles during exercise. When combined with creatine, beta-alanine may enhance the effects of creatine by reducing fatigue and improving endurance. However, beta-alanine may also cause a tingling sensation in the skin, known as paresthesia. This sensation is harmless, but some people may find it uncomfortable. When combining creatine with other supplements, it is important to properly dose and time these combinations. For example, when combining creatine with caffeine, it is recommended to take the caffeine 30 to 60 minutes before exercise and the creatine after exercise. This allows the caffeine to improve energy levels during exercise while allowing the creatine to enhance recovery after exercise. When combining creatine with beta-alanine, it is recommended to take both supplements daily, but at different times of the day to avoid the tingling sensation. While creatine is generally safe for most people, there are some important considerations to keep in mind before starting a creatine supplementation regimen. Firstly, it is important to be aware of potential interactions between creatine and certain medications. For example, creatine may interact with diuretics and nonsteroidal anti-inflammatory drugs, NSAIDs, which can increase the risk of dehydration and kidney damage. Additionally, creatine may interact with some medications used to treat diabetes and high blood pressure, so it is important to consult with a healthcare professional before starting creatine if you are taking any medications. Another important precaution to take when supplementing with creatine is to stay hydrated. Creatine can cause water retention in the muscles, which can lead to dehydration if adequate water intake is not maintained. It is recommended to drink at least 8 to 10 glasses of water per day when taking creatine to avoid dehydration and potential kidney damage. Another consideration is the potential for false positive drug tests. Creatine is not a banned substance, but some sports organizations may test for it in drug tests. While creatine itself will not cause a positive drug test, some creatine supplements may be contaminated with banned substances that could lead to a positive test. To avoid this, it is important to choose a high-quality creatine supplement from a reputable manufacturer. It is also important to note that creatine may not be suitable for everyone. Individuals with a history of kidney disease or liver disease should avoid creatine supplementation. Additionally, pregnant and breastfeeding women should avoid creatine, as there is not enough research on its safety in these populations. That's all for today's lecture. Hope you enjoyed it. Check out our page for more educational content. Have a nice day.